committee meeting or cabinet meeting for us to receive a report from the Department of Agriculture and Rural Development on trends that they've observed that they feel that if you can't communicate them urgently to society as a whole, we might be undermining a very serious disaster that is taking place within our province. So we'll outline an improved government-coordinated response, control measures, and strategic interventions to contain the foot and mouth disease in Gauteng. And this intervention, obviously, will have implications in terms of movement of animals in our province, the handling of animals, but also the need for us to ensure that it doesn't harm the economy of our province. Because if it harms the economy of our province, you will see the escalation of food prices, especially beef, and other related prices that may make food security a difficult aspect in our province. So the foot and mouth outbreak, which has been unfolding over several months, has reached the level of a nationwide animal health crisis. You are aware that the Agriculture Minister, Mr. Steenhuisen, is already exploring the possibility of tabling a declaration for a national state of disaster. Infections are confirmed across numerous provinces, with Gauteng being the hardest hit. The origin of the Gauteng outbreak can be traced back in April 2025 in the Western municipality, where investigations indicate the likely cause was the unlawful transport of cattle from an infected zone in KwaZulu-Natal during an auction. As of January 2023 this year, the province is actively managing 195 lab-confirmed outbreaks. It is estimated that more than 261,000 animals are now affected in our province. This crisis has serious consequences for the economy and society at large. It will disrupt trade, it will threaten jobs in the livestock sector, and without doubt, it will affect the income of small-scale and community farmers. So it's within this context that we felt as Gauteng we need to respond and share our response mechanism. And I'll allow the MEC responsible for agriculture and rural development, Vuyiswa Ramokgopa, to take you through the Gauteng response and areas of interventions and the resources that we've unleashed as the provincial government to contain this pending disaster. Vuyiswa Ramokgopa.
Thank you, Premier Lesufi, and good morning to the members of the media present, and good morning as well. I'd like to just recognize the presence of the Director of Animal Health and the Director of Veterinary Services in the province, who are also with us this morning. As Premier has alluded, the Gauteng Department of Agriculture and Rural Development has done extensive work since the outbreak was first detected in Gauteng in 2025. In recognition of the fact that the Gauteng province is a national logistics hub and that our efforts to contain illegal animal movements and deal with critical constraints in vaccine supply have been a challenge, the provincial government has therefore adopted an accelerated, multi-stakeholder, rapid response approach. This model is aligned with the national FMD strategy, but aims for earlier suppression of the virus and progression towards disease freedom in the province. Now, while the National FMD Control Strategy aims to regain FMD-free status, regulated under the Animal Diseases Act over a 10-year period, the goal of the provincial government is to quickly suppress the virus and achieve disease-free status as soon as possible, while complying with national and international World Organization for Animal Health standards. This approach brings together experts from veterinary science, law enforcement, transportation, environmental management, and the social sector, including community leaders and traditional authorities, to make a strong and unified response possible. This strategy focuses on containing the outbreak first, following the regulations, expanding vaccinations to improve herd immunity at a provincial level, and ensure that we have clear communication channels with our stakeholders and the various role players in the industry. Some of the key actions to date, which we have already announced, but it's important for us to recap. About 16 million rand from the Comprehensive Agricultural Support Program has been allocated to be used for vaccine tests, cleaning supplies, and additional mobile units to help stop the spread of the disease. These are particularly helpful in areas where there's communal grazing, as well as in township areas where mobile units are needed. With regards to vaccines, more than 286,000 doses have been administered and 90,000 more have been ordered, which we are expecting to take receipt of towards the end of March. In terms of quarantine, all affected and infected farms are under strict quarantine measures, and new cases are being investigated as soon as and whenever they are reported. And in terms of communication, in our effort to raise awareness, the department is conducting direct consultation with farming communities to ensure compliance and combat the scourge of misinformation. Now, to support the ongoing efforts of the Gauteng Department of Agriculture and Rural Development, the provincial government convened a special one-day executive council meeting over the weekend, and the purpose was to review and deliberate on the current progress in containing foot and mouth disease in the province. The meeting acknowledged that the outbreak is a serious threat to the province's livestock industry, food security, and the livelihoods of residents in the province. It praised the department's rapid actions to curb the disease and resolved to reinforce and substantially intensify the existing measures. And this will be done by implementing a series of measures and mobilize other departments in the province to enhance our overall response. I'm going to take you through some of the measures specifically that were approved by the EXCO. The Special EXCO has directed the Gauteng Department of Community Safety, Transport, Environment, and Cooperative Governance and Traditional Affairs, as well as local municipalities and the Security Cluster to officially participate in the Gauteng FMD Rapid Response. These departments are to ensure operational coordination, enforcement, and information sharing. The meeting also directed the Department of Transport and the Security Cluster to provide immediate operational support to GDAD. This will include the establishment of roadblocks, checkpoints, and route controls in identified high-risk areas. Attention will be paid to access routes in areas like Dinukeng, where there is an imminent risk to disease-free buffalo populations and other valuable biodiversity assets becoming infected. The Department of Cooperative Governance and Traditional Affairs will facilitate and coordinate intergovernmental relations sessions, and this will ensure all provincial municipalities are kept informed and can activate their structures to help expedite the implementation of all adopted national and provincial interventions. All departments must work together to combine existing systems, technologies, and resources, and this will improve how we track vehicles and animals, leading to better disease surveillance and enforcement. The meeting instructed the provincial government working with municipalities to implement a comprehensive and proactive communication strategy that will keep all stakeholders informed, counter misinformation, and ensure that there is a clear public understanding of the coordinated national and provincial response to the FMD outbreak. And lastly, the Gauteng Department of Agriculture and Rural Development, together with the veterinary services, will continue leading farmer engagement sessions across the province to ensure community-specific interventions. The consultation and stakeholder engagement process will also need to include auctioneers, who are the major stakeholders regarding interprovincial livestock trade and movement, as well as other relevant stakeholders in the sector. The provincial administration reiterates the call for a cohesive national and interprovincial strategy on FMD because no province can overcome this challenge in isolation. Furthermore, Gauteng adds its voice to the urgent need and reiterates the call for the urgent need for the development of local vaccine manufacturing capacity in South Africa, led by a fully resourced Agricultural Research Council to ensure self-reliance in future health crises. The provincial government also calls on all farmers, livestock owners, and industry stakeholders to act as responsible partners by fully complying with departmental processes and immediately disclosing infected animals and strictly adhering to all regulations to contain this disease, while also urging them to rely on official communication channels from GDAD and other national authorities. The Gauteng government is confident that a transparent, cooperative, and integrated strategy will be key to containing the foot and mouth outbreak and safeguarding the provincial agricultural industry. We also thank the other departments led by the Premier in the province for their cooperation and pledge to assist us in addressing this outbreak. I thank you.
Thanks so much, MEC. You can see from this intervention that we need to strictly adhere to the suggested strategies. With the Department of Community Safety and the SAPS, who are going to assist us in manning roadblocks and ensuring that the movement of animals in our province is strictly monitored. We've also taken a very important decision as Cabinet to have a subcommittee led by the MEC to really ensure that there's intergovernmental relations. Where support is needed, we have to unleash that support immediately. And within that context, we are of the strong view that we can contain this unfortunate situation that we find ourselves in. The last part is our stakeholder relations. If we don't work with the stakeholders in the sector, we're not going to succeed. And where we are, we don't want to point fingers, we want to arrest the situation. And we have to ensure that whoever has a role to play as a stakeholder, they play that role. We understand the inconvenience that some of this intervention will cause to the sector, but we have no choice but to maintain, monitor, and ensure that this situation does not spread beyond our province. We are the hardest hit. We're the economic hub of the country. If we can't get prices right in Gauteng, we're not going to get prices right across the province. So the sooner we contain this, the better. And we really believe that the intervention mechanisms that we're proposing now are intervention mechanisms that will assist us to contain the situation. We want to work hand in hand with the national government. Actually, we're doing so already. But as Gauteng, we really believe that we need to accelerate our efforts to provide that kind of support to national government. Elijah, we think that we have conveyed the message, and from the look of your colleagues here, they're not only satisfied, they've grasped the message, and they're willing to let us go so that they can go and execute. Thanks, Elijah.
Thank you very much, Premier. The instruction is clear, but let's give them an opportunity,
Okay.
at least one opportunity to ask questions. I'm seeing 3, 4 hands already. 5, 6, 7. It's like this.
So I misdiagnosed. Yeah.
Colleagues, can you please raise your hand? I just want to see how we're going to do this. Okay, let's just go row by row. We start with the front row and we go back. I think that will help us. And let me start on my far right. Thank you, Speedway Kaya. Please go.
Thank you so much, Mr. Mhlanga. Good morning, Premier MEC.
Morning, please.
MEC, when we engage with the farmers, have they ever mentioned to you or asking you to personally vaccinate their livestock? Because currently it's under government. For sure, some are asking if they can do that on their own. Thank you.
Thank you very much. Just next one, please. Name.
Silva Sevilla from UFM.
I just want to find out, is this the worst outbreak that has ever happened, considering that it's been some time now failing to contain the outbreak? And are you able to estimate on when can you contain this disease? Thank you very much. We're still on the front row.
Hello, my name is Gwena Mashaba from the Sowetan. My first question is on the capacity of the province. Does the province have the actual capacity to assist the farmers in getting their vaccinations on time? The second question is on the fact that this has been an outbreak from April 2025 and we're now in January 2026. The minister himself has said that it's more the priority of the province as well as the nation is to contain the outbreak. The message has always been containing. But now it seemed as if it has spiraled out of control, leading to, over thousands already in Gauteng, and not to even discuss KwaZulu-Natal and the other provinces. How bad can you say the situation has been to even now declare or think of considering a national disaster? And then the last question is the fact that farmers on the ground are saying the vaccines themselves are not working if the cows are getting them after they've already been infected. And what also is troubling for them is the fact that there's a time span between the first vaccine and the second one. And I understand that the country is getting their vaccines from Botswana and other countries that are providing. What is the timeline between those vaccines? Because the farmers, as well as experts, are saying it's crucial that the timelines between the vaccines are provided early. So I just wanted to understand the capacity of the province on that.
Thank you. Last one in the front row.
Hi, Vuyiswa Ramokgopa from Italy. And just to appeal on my colleague's question, I wanted to know, the outbreak has been there for a while. Aren't you a bit late in these interventions that you're coming up with now? And in terms of vaccines, you said there are about 90,000 more that are expected, if I heard you correctly. Where are you getting those from? Because there have been delays from Botswana. We understand that the minister has tried to procure somewhere else, and our farmers are not happy about those delays.
All right, thanks very much. Premier MEC, let's take responses from the questions asked by colleagues on the front row.
Okay. Thank you. I'll try and stick to the order in which they were asked. Pitso from Kaya, there have been calls made by the farmers or requests made by farmers wanting to procure their own vaccines. But of course, as it stands right now, this is a state-controlled and state-managed disease. That is what the legislation dictates at this point in time. I'm aware that the minister is currently looking at measures to perhaps relax some of those regulations, but we operate in that environment. So as it stands right now, it is the state veterinarians and the state vet services that have the responsibility and mandate of procuring and distributing vaccines. And that said, I think our key issue here is really availability. It's not so much that they are not being distributed, it's that they're not here. Number two is this is certainly the worst outbreak that we have had since South Africa lost our FMD free without vaccine status in 2019. It is not the first outbreak, as you'll note. There have been outbreaks in the past. Almost annually there have been outbreaks, but under normal circumstances they were, the protocols were put in place and they've been able to be controlled and managed and contained. And in fact, I think there's the National Department and the state vets have actually built quite a bit of capacity in terms of being able to manage those outbreaks in the past. This one, unfortunately, for a number of reasons, has gone on longer than would have been expected or desired, and that is why we are now at this point saying we actually need to up the ante in terms of our own response. It really cannot be business as usual in terms of the standard response. From the Sowetan, Gwena, let me put it this way. In terms of capabilities and capacity, yes, the capacity is there. But if we are to successfully roll out a mass vaccination campaign as it is envisioned and has been communicated by the Minister, there will certainly need to be additional capacity that is brought in to make that possible. So if and when that becomes the case, or rather when that becomes the case, there are already discussions about where that additional capacity would come from, and obviously there would have to be resources availed to make that possible. And containment, indeed, is the primary strategy, and I think that's where we want to really enhance our efforts. And that is one of the core pillars of the provincial rapid response approach. It says, you know, ourselves alone as the department cannot enforce and cannot oversee the containment measures ourselves. You'll find, for example, that we would have placed a farm under quarantine, and they may well be adhering to the standards, but there may be communal farmers whose livestock is able to move freely and does not adhere to the same quarantine standards. Or you have auction houses and traders of livestock who are not adhering to the Animal Diseases Act and the prescripts of that. So enforcement is actually really key, hence why we have reached out to some of our sister departments to ask for assistance in this regard. And I think this is an important point you make about the effectiveness of vaccines. The vaccines that are administered do have to have a booster dose that then gets administered within the requisite period. So that is indeed part of the strategy. When we speak about the 286,000 doses that have been administered, a portion of those are primary doses, and then there's already been an initial rollout of booster vaccines. But our issue, as I'm saying, has been the shortage thereof. So it does not help our efforts to not have vaccines available. They came from Botswana, the 90,000 that we've been able to procure. But we are hoping that through the investigations being done by national government now, that there will be other sources that become available. The key thing, and this is the challenge really in finding alternative vaccines, is that the strains, the SAT1 and 2 strains that we see in South Africa, and I think now there's also a SAT3, we need to find a vaccine that can actually address all of the strains, not just one of them. So that becomes the complexity. You may find in one of the countries their vaccine addresses only SAT1, the other one does only SAT2, or so on and so forth. So we need to be able to find a vaccine that does it all. And that's why we are reiterating the call that in the bigger picture, in the long run, we've got to rebuild our capacity and effectively our sovereignty as far as vaccine production is concerned. I think I may have touched on or answered your question, Dimakazo, but essentially the vaccine and the outbreak rather is not static. There have been ebbs and flows, and as we are now recognizing, we really cannot simply wait on vaccines, and we do need to look at other measures around containment, enforcement, but also bringing role players in the industry together to also shape behavioral change in communities so that we're not reliant solely on the police and the security cluster. Thank you.
Thank you, MC. Thank you, Premier. Let me welcome the DG of the province, Mr. Musue, as well as the HOD for the department, Dr. Masade, when we are going to the second row to take the questions. I don't see where the microphone is. Okay. Okay. Theodore,
Yes, good morning. There's clearly like a problem when it comes to the vaccines being procured from other countries. Why have we not developed a vaccine of our own as a country, since this is a persisting problem? Is that something we are looking into the future? Maybe developing a lab that could look into the disease and all the strains and continuously do so.
Good afternoon, Premier. Alpha Ramoshana here from Eyewitness News.
Good morning, Alpha.
Apologies, I'm going to ask you to put on your ANC cap.
I've left it in the office.
What do you make of the ballot papers or alleged ballot papers that were filed?
I left that cap in the office.
What do you make of the ballot papers, Premier, that were found in Pretoria from the ANC's conference in Johannesburg? Do you believe that those ballot papers were indeed used in that conference that Soldier Damara used to Vuyiswa Ramokgopa. Thanks.
From vaccine to ballot papers.
President, please.
Neria from the SABC. I just want to know how much has been spent so far, especially when it comes to the procurement of vaccines. I remember last year, MEC, you had indicated that at least you would spend 100 million of your 671 budget on veterinary services. So I just want to know, with containing this and in getting vaccines, how much has been spent by the province? And another one is, as you get these vaccines that you're waiting for, is there a plan in terms of distribution? Which areas are going to come first, followed by which ones, and yeah, those are the two.
Thank you. Next.
Good morning, my name is Lebahan Dashe from YFM. My questions are directed to the MEC. As you mentioned in your speech, that 16 million rand has been diverted from the gas in order to curb this disease. However, a body that represents black farmers in Gauteng has actually slammed that decision, saying that it will affect emerging farmers. So my questions are, why was the 16 million rand taken from the Farmers Development Fund instead of sourcing emergency or national funding for the foot and mouth disease? Secondly, were black farmers or their representative bodies consulted before the decision was made? And lastly, how will this diversion fund affect existing supporting projects for emerging farmers and small-scale farmers this financial year?
Thank you very much. We're done with the second row. Premier, we can take the responses to the questions. Thank you.
I'm a conveyor belt today.
Thank you. So I think, this is at the heart of the issue, the question from ENCA about why we have not yet developed our own vaccines. It is the biggest question. There was a time when we were manufacturing those vaccines 10, 15 years ago through the Honest Aboard facility run by the ARC. And our view is that we need to get back there. We need to rebuild capacity, ensure that that institution is capacitated with the best management, the best leadership, that's adequately resourced, where there is infrastructure that needs to be reinvested in or maintained. It must be, because we're dealing with highly sensitive scientific equipment here. It must be maintained over time. So we fully support that call. We want to see that institution being rebuilt, recapacitated, and for us to get there. And I think that should really be the top priority at this point in time. I'll leave other questions about ballot papers to yourself, Premier. Let me talk to the SABC's questions just around the planned rollout. So it is largely driven by infection rates and where we see the highest risk. And our approach thus far has been two-pronged. It's really been focusing on communal farms and sort of the rural and peri-urban areas within the province. And actually, it's also about, it's about focusing on uninfected animals to prevent them from becoming infected. That's what vaccines are about. So it's really driven by where the infections may be. So the focus when we do get vaccines would be at that point in time to do that assessment, to understand where the key risk areas are. But we've seen so far some of the highest infection rates in the eastern sort of periphery, East Rand side of Gauteng. We've also seen outbreaks, significant outbreaks in the Randfontein areas, as well as now we are seeing early signs of outbreaks in the Tshwane area. And we also received, reports from Dinokeng Game Reserve requesting intervention because there is livestock that is being transported on provincial roads through the actual game reserve, which risks putting their livestock in terms of buffalo that are in the game reserve at risk. So we are going to be doing those assessments, and on an ongoing basis. And as we see, risk areas, we then obviously are then able to pivot our efforts towards those areas. In terms of the actual amounts that have been spent, I'm not sure about that 100 million figure, but I'll have to come back to you on the exact figure. What we let me start by saying that veterinary services is a core part of what the department does. And even when we receive our CUSP allocation, I think you might be talking about that, we receive for this year 111 million rand for a CUSP allocation. Now that 111 million rand is meant to serve farmers across all commodities. And that is farmer support in general. Then further to that, there is also funds that are allocated towards veterinary services specifically. And this is not just related to FMD. There are ongoing veterinary services that are ongoing in the province. And again, a lot of our work is done and supports farmers who cannot ordinarily procure these services through the private sector. So a lot of your small-scale farmers, a lot of your African farmers and traditional farmers. And this is what a big chunk of what our service entails. So in the reallocating of these funds, and here I'm also dealing with the question from YFM, to be honest, I'm not too familiar with the organization. We engage with a number of recognized industry bodies. This is the first week that I've ever heard of this organization, so I'm not sure where who they represent necessarily. But what I will say is that we have engaged with various industry organizations, including the likes of the AFASA organization, African Farmers. We have been engaging directly with communities and farmers in these specific communities themselves directly and getting input from them about our plans and how we are rolling out. And a big portion of our support program is actually there to support small-scale farmers. And cattle farmers are farmers, and I just want to drive that home. I think there's a perception that in putting our funds towards FMD, we are somehow not supporting farmers. That's just not true. And in fact, a big portion of cattle farmers are African farmers. And so it is actually imperative that we protect this industry and make sure that we protect not only people's livelihoods, but their wealth and their investments and the little bit that they have and avoid a potential crisis on our hands, which we could have if we don't do anything. So that is really what has driven the decision. We recognize there's an urgent need. We have to address the need, and I think as a province, it would be negligent of us not to take any steps in the face of a crisis.
Thanks. Let me assist Alpha so that the editor, the office must not give you difficulties. Upon realizing what was happening in our province over the weekend, Alpha, we immediately convened a special provincial task team meeting on Sunday night, where the item was tabled. And after intensive discussions as the provincial leadership, we were of the strong view that we need to engage with our national leadership, and on the basis of that, we'll be in a position to provide a detailed response on this matter. We are monitoring the situation. Our national leadership have already made contact with us. I think in due course, we'll be in a position to issue a statement that will clarify some of the areas that need to be clarified. Thanks.
Thank you, Premier. Thank you, MEC. Let's go to the third row. If colleagues are still there. So your questions have not yet been addressed after so much.
Yeah.
Okay, that's fine. You can go, please.
Good morning. My name is Steven Siakwe from Mapepeza Community Newspaper. 2 questions. First one, it's related to community and peri-urban farmers. They usually do sell their livestock for traditional ceremonies to presidents. And we just want to know, in terms of those interventions in the security cluster, will it limit movement of cattle that is sold for consumption from farm to residents? And then secondly, we just want to understand, how are you going to do consumer education? Because now, quickly news is spreading about this, and it can create some misinformation, especially with consumers now saying that beef is more expensive because we have a crisis. And what we're going to do as the department to actually combat misinformation specifically, because you said in your statement that you are intervening, but we just want to know specifically what you are doing. Yeah. And then can I just squeeze in this one lastly? The Argentinian vaccine has been advocated by current beef to be most effective. I don't know against to actually look into the Argentinian vaccine to actually see what they can do. So I can just put that as a suggestion to say, can you put it as part of your research to see if South American guys have the best things. Thank you.
You're not even propagating a Tembisa vaccine.
Good morning. My name is Tato Khorolo from News 24. Another vaccine question. This one in particular about the privatization of vaccines. So should Minister Steenhuisen relax the portions of legislation to allow for the private manufacturing of them? Would the Gauteng government have the capacity to engage the private sector enough to fast track the manufacturing and acquisition of the private vaccines? Because I've been seeing some organizations complaining that if we were just allowed to, everything could move so much quicker. So I wanted to see, whether it would help or it wouldn't. And why are we only clamping down on inter-provincial livestock transport now, considering there was an Indaba plan that went ahead, I believe, in July last year, where this was all addressed and pushed, and now it's effectively 6-7 months of just free reign transport, it seems. Thank you.
Thank you very much. I suppose that was the last question of the media briefing.
Neria.
No, we're just finishing the third row. We'll come back to follow-up questions. MC?
Okay. Thanks, Stephen. I think those are some really important questions that you've raised. And this is actually at the heart of why we have felt the need to accelerate our response in this manner. Because one of the challenges that we certainly do have is that in communal areas or in rural areas where there's communal grazing, a lot of that livestock is indeed traded in those very same areas, or there could be movement of livestock that is unmonitored and that either has not been vaccinated or should ordinarily be under quarantine, etc. So our intention is to make sure that the industry experiences as little pain as possible. That is where we're going with this. If we can accelerate the containment of the spread of the virus, and we can make sure that at the very least, those who are moving product, we're not saying don't move your product, we're saying make sure that when you do move your product, that you do so following the prescripts of the regulations. If your animals are infected, that you are quarantined. If you are not yet infected, and you're eligible, you can then get a vaccine, and so on and so forth. So we're really saying we just want everybody to adhere. Similar to COVID, it doesn't work if only one group of people do everything properly, because it spreads to us all. So it really has to be something that is a joint effort. And a key part of that is indeed around consumer education and engaging with communities. And that's why we have taken the step and said we are going to establish a multi-stakeholder consultative forum for this very purpose. It's not an advisory panel, it's a consultative forum such that any bodies, any groups, any organizations, traditional authorities, traditional leaders, Izinduna, anybody who is involved in the livestock sector, the auctioneers, etc., have the opportunity to engage directly with members of the Joint Operations Committee and actually give input, suggestions, and receive first-hand information. There's only so much. I think, of course, people like yourselves help us very much in disseminating information, but we also need to be able to engage directly with communities, and that's the purpose of that. I can't comment. I won't comment too much on the Argentinian vaccine, but I'll just reiterate the call that we need to build capacity to produce our own. I think there are temporary measures, yes, that we need to look into, but let's not go down the wrong road. The road we want to be on is the one that takes us to a point where we can produce our own vaccines, and in fact we can be selling to the rest of the world and rebuilding our own domestic capacity. Tato, in terms of the kind of timing of this response, you would know that the minister only announced the national FMD strategy, I think, a week and a half ago. It was only after that briefing, in fact, that the provinces were then briefed about what that actual strategy is. So it's been very important not to put the cart before the horse and to make sure that whatever interventions we are envisioning are actually aligned with whatever the national strategy is speaking to. So it has been now, I think, about a week since we received an official briefing as the province. We've been quite busy now putting together this strategy, which has then had to go for cabinet approval. It's received our own cabinet approval through EXCO, and this is where we are today. So it really is not, it's not a matter of not wanting to act with urgency. I think the topic of vaccines perhaps has somewhat been exhausted. My view is that we do have to take a short-term and a long-term approach. In the short term, where there are vaccines that are appropriate and that are able to address the strains that we have locally, whether they are being manufactured in South Africa or outside of South Africa, we should put ourselves in a position to procure those vaccines and make them available and deploy them into the market as quickly as possible. That's the objective. You know, and I think that should be the short term. In the long term, of course, as I've said, we need to be able to produce our own vaccines. Thank you.
Yeah, there were two follow-up questions from Neria and Pitso. Those are the last ones. Give Pitso the mic, he's close to it.
Thank you so much. Let me see a follow-up question. I'm looking at the room here. I see precisely red meat eaters. We completely receive maybe give confidence to consumers as well as everyone that you know, this disease is primarily, you know, a livestock issue, and you know, from your authority that it is not a human health risk, and people can still eat red meat. Thank you.
Those fries will continue.
Just a follow-up from me. It's just about the money. How much has been spent so far to fight, to contain, to vaccinate, just on FMD, the fight against it? And then also how much has been set aside? Because we heard that the plan is to have a multi-department strategy where community safety comes in, where COCTA comes in also. So there has to be a budget set aside for all of this. The so far budget and the set aside for now budget, please. Thank you.
All right, Christoph. Let me see, this will be your concluding response.
Okay, no problem. Thanks. So thus far, there has not been additional budget that has been put towards FMD. It wasn't necessary. Veterinary services, as I said, is part and parcel of the work of the department. We have full-time state vets, as well as those who assist the state vets with rolling out vaccination campaigns, even when it's not FMD related. So we haven't spent anything additional. The vaccines that we received previously, the 286,000 doses that we received, were received from the national government as part of the allocation that came to the province. So we did not have to procure over and above anything in that regard. So there has not been additional expenditure to date. But as you're correctly saying, what we have now done is we've said, since we now going forward, in our attempt to procure more vaccines over and above our allocation that we received, because allocation doesn't even get us close to what we need, we then were able to put some budget aside to then procure not just vaccines, but also other material related to being able to roll that out. So that would be the very first additional expenditure that would have been incurred. And I'm not going to speak on the part of other departments, but the intention is not to increase or to be augmenting budgets. The intention behind setting up a coordination forum is to work smarter together. So we're not saying you need more law enforcement, you just need the actual available law enforcement to enforce the law. That does not need additional budget. You don't need to set up new roadblocks. You need to make sure that at the roadblocks that currently exist, they are not just looking at your license disc. They are also checking to see if your animals have the correct papers, and thus making sure that the law enforcement officials are briefed accordingly, that they have the correct information, and that they're able to execute their duties accordingly. Similarly, when it comes to intergovernmental relations, we're working with COGTA. This is part and parcel of their mandate. Organizing and facilitating intergovernmental relations does not require additional budget. What it requires is a coordinated approach and ensuring that we are convening people to address the specific issue. So there has not been discussions about budgets at this point in time because the need has not arisen. I believe should it arise, there would be full disclosure to that effect. Thank you. Sorry, Bizo, this is the most critical one about the human risk. And I'm glad you've asked this question. I think it's important to reiterate. There is absolutely no risk to humans of contracting FMD. Unless maybe your isithakazelo sakho kinkomo, you might have a challenge. But other than that, in terms of humans, you are not going to get, there's no health risk. So it's defined as a zoonotic disease, and not to be confused with hand, foot, and mouth disease. I think that's also where some of the confusion arises. Hand, foot, and mouth disease is one that we have heard about that does affect humans, and particularly is prevalent in young children. But foot and mouth disease specifically is it is an animal-based, an animal health issue, and even meat from animals that had previously been infected with FMD cannot infect humans in any way and cannot cause any illnesses. So those who are red meat eaters, I encourage you to continue enjoying whatever red meat you are enjoying, and those of us who are choosing another path can also continue to do so. Thank you.
Thank you so much, MEC. You can derive from the intervention that we are making now that we want to protect the economy of the province, but at the same time protect a very important sector that is contributing to the economic development of our province. We also want to protect those that might not have the resources and the capabilities nor the skills to ensure that their livestock is protected. So as a Gauteng provincial government, we want to make that intervention. But we also want to urge those that wants to use this as a political football, that there's no need to do so. No need at all. What we need to do is to contain, prevent, and ensure that the sector prospers. And our approach as the Gauteng government is to invest in those initiatives. I think the MEC was correct. We don't have any additional funds. If we're supposed to meet with local government, for example, from COGTA point of view, we'll just add an agenda item of FMD. If we're discussing cutting of grass or filling of potholes, we'll add these new agenda items when we have those discussions. But municipalities play a crucial role, and that is why we want to bring them on board as quickly as possible. And we'll be meeting with them later this week so that we can assign them some responsibilities that we think they need to execute on our behalf. But as the Gauteng government wants to send a message to all our farmers that we care, and also that we understand the situation in which they are operating currently. Whatever that we do is not to make the situation worse, but to alleviate the pressure and give them the necessary guidance. And therefore we'll appreciate cooperation. Where they feel that we need to support them, we are ready to do so. And where we feel we need their cooperation, we hope that they will do likewise, so that we can jointly defeat this challenge that is facing us. And we can be in a position to say we have defeated FMD in our province. Thank you once more for your attention. We truly and honestly appreciate your participation in this briefing. Thank you.
Thank you, Premier. That's how we conclude. Much appreciated.
Thanks, MEC.
Thank you.
Thanks.
I'm reminded with that is
Can I have this phone?
there's snacks outside, colleagues.
It's a nice phone. Is it yours?
Mama,
Oh.